Hello dear students, welcome to Dr. Espinac Medicine classes. In today's class, let us try to learn about hepatic disease or liver disease. So I am going to explain about liver disease, hepatitis and liver failure conditions overview. I will be explaining different causes and clinical presentations and management of different hepatitis conditions, and this is just a overview, and this video will help you only in the writing examinations. So please don't treat the patient based on these treatment options. Okay, so this video is only for exam point of view for PharmD and BPharm students. Liver disease. Actually, in the syllabus and in most of the disorder conditions, we see as hepatitis. So hepatitis is one of the major condition. So we are going to discuss about hepatitis, which is also called liver disease or hepatic disease, and most of the time hepatitis is a symptom for hepatic disease or liver disease, and hepatitis is an inflammation of liver, and if hepatitis is continued, if it is not treated, hepatitis undergoes cirrhosis, which is a irreversible or dead tissue of the hepatocytes. So cirrhosis is also called fibrous scars. So cirrhosis is mainly associated with fibrous scars in the hepatic tissues. So we'll discuss about hepatitis in detail now. So I think in the BPharm and in PharmD we have a concept called hepatitis. So I'll try to discuss the overview, different causes of hepatitis, and different treatment options for hepatitis. And listen guys, hepatitis means, just remember, hepatitis is nothing but liver disease, and if hepatitis is not treated, I told you, it causes cirrhosis, and if cirrhosis is continued, finally the liver will undergo to next final stage called liver failure. So liver failure is final state or complicated state in the hepatic diseases. So now we will not discuss about the liver failure and cirrhosis, we will discuss about the hepatitis, which is a very common condition which is associated with many causes, or which is the main reason for cirrhosis and liver failure. So let us see in detail about liver disease and hepatitis. So before understanding about the hepatitis, let us see some basic things. So I think you all know that liver is it comprises 2.5% of total body weight of the human being, and it is roughly 1.5 kgs body weight, 1.5 kgs. So the normal weight of the liver is 1.5 kgs, and it is one of the largest organs of the body. Okay, and the liver is very important organ. It has major functions in the body. Let me discuss in 3 different functions. So the first function of the liver is synthetic function, and I think you all guys know that liver is a very important organ, and it is a factory of the human body. It produces many enzymes, hormones, proteins, amino acids, everything. So synthetic function is very important, and among all this, it synthesizes vitamins, and among vitamins, vitamin K is very important. So these are synthetic functions of liver. And the next function is storage function. So it is a storage, actually liver is a storage organ, and it stores all excess amount of vitamins, proteins, carbohydrates in the form of glycogen. So it stores almost all the nutritious items which are essential for the body in the required positions. Okay, so storage function is very important function of the liver. And the final function is metabolic function. Metabolic, or it is also can be denoted as detoxifying function. So I think you all know that liver is a very important organ, and which has detoxifying function. Whenever a patient takes a drug or exogenous toxin or anything, all the exogenous chemical compounds are first screened into the liver. They enters into the liver, and it undergoes first pass, second pass, and third pass, and it is metabolized, or it is detoxified, and finally the detoxified elements will be excreted through urine. So metabolic function is very important function of the hepatic tissues. So these are 3 different functions, and among this, the liver is also having many other functions. Okay, I will not go in detail about the functions of liver. Now let us see the causes causes of hepatitis. We'll discuss about the causes now, because in the examinations you can write the hepatitis from the causes to the treatment. So you have to explain about the different causes of hepatitis and how to treat all these causes, and pathophysiology also. It will be helpful for you in the examinations. Okay. So now let us see the causes. The first very important cause for hepatitis is viral cause. Not only viral, some hepatic causes and fungal causes are also there. In the viral causes we have hepatitis A virus, hepatitis B virus, hepatitis C virus, D virus and E. So hepatitis A, B, C and D and E. So we have different viral infections that causes hepatitis. I will discuss about these viruses in the later classes okay. So the first major cause of hepatitis is viral cause, and the next one, autoimmune cause, autoimmune disorder. So in autoimmune disorder we have primary biliary cirrhosis is one autoimmune disease, and we have autoimmune hepatitis, which is another disease that causes hepatitis, and we also have primary sclerosing cholangitis. Primary sclerosing cholangitis is another autoimmune disease that causes hepatitis. So these are autoimmune disorders that causes hepatitis, and we have vascular abnormalities. So vascular abnormalities are another causes for hepatitis, and vascular abnormality is nothing but some abnormal diseases in the blood vessels that supply to the liver, and the blood vessels that supply from the liver to the different tissues. Let's consider this is a liver, and actually while discussing about the vascular disorders, so we have a very important blood vessel called hepatic portal vein. So any disorder or any dysfunction in this vein will cause hepatitis. So that may also cause hepatic hypertension or portal hypertension, that is called portal hypertension. So vascular disorders, which includes hepatic portal vein or dysfunction in the blood vessels which are associated with the liver. So even that is one cause. And among these vascular abnormalities, there is a very important syndrome called Budd, B-U-D-D, Budd-Chiari syndrome. So it is also called BCS. Budd-Chiari syndrome is one of the syndrome which is associated with vascular disease. So this syndrome is another cause for hepatitis. So this is one cause, and we have some metabolic causes. In metabolic causes, there is a very important disease or syndrome called Wilson's disease. Wilson's disease is one cause that causes hepatitis. Actually, Wilson's disease is characterized by accumulation of copper. Copper is accumulated in the liver and in some of the major organs, and that causes hepatitis. Actually, this is a genetic disorder where accumulation of copper takes place in the body, and that causes hepatitis. And there is another condition called hemochromatosis. Hemochromatosis is one cause. So it is very similar to Wilson's disease. Actually, in Wilson's disease copper is accumulated, but in hemochromatosis iron is accumulated at the rate of absorption, and its accumulation occurs in the liver, in the heart and many other organs, and that causes hepatitis. So hemochromatosis is another very important cause for hepatitis. And we have alpha-1 antitrypsin deficiency. Alpha-1 antitrypsin is very important enzyme. Actually, this enzyme reduces the activity of trypsin, chymotrypsin, amylases and many other enzymes which are present in the liver. But in the absence of this enzyme, alpha-1 antitrypsin enzyme, or in the alpha-1 antitrypsin deficiency, all the other enzymes like proteases and trypsin and chymotrypsin enzymes elevates, their activity increases, and that causes damage to the liver cells, and that causes hepatitis. So alpha-1 antitrypsin deficiency is another cause for hepatitis. And we have glycogen storage disease. Glycogen storage disease is another disorder or disease that causes hepatitis. Actually, glycogen storage disease is characterized by abnormal storage of glycogen. So abnormal glycogen storage occurs in the liver, and that causes hepatitis. Actually, this disease is associated with deficiency of many enzymes in the liver, in the synthesis of glycogen as well as in the production of glucose and glycogen. So glycogen storage disease is one disorder that causes hepatitis. And we have a very important syndrome called Gilbert's syndrome. Gilbert's syndrome. So Gilbert's syndrome is one syndrome, and this Gilbert's syndrome is associated with unconjugated hyperbilirubinemia. Unconjugated hyperbilirubinemia. So bilirubin levels increases in Gilbert's syndrome, and that causes hepatitis. Okay, so Gilbert's syndrome is another cause for hepatitis. So these are some of the major causes for hepatitis. Now let us see major clinical presentations for hepatitis. As you all know that when a hepatic cell or hepatic tissues are degenerated or dysfunctioned, all synthetic storage and metabolic functions will be stopped, and patient will have to suffer from many clinical presentations. And among clinical presentations, listen guys, patient will have to suffer from abnormal protein metabolism, abnormal carbohydrate metabolism, and abnormal production of vitamins, storage of vitamins, and everything. So vitamin deficiency occurs, especially vitamin K deficiency occurs, and due to deficiency of vitamin K, there are clotting factors, especially clotting factor 5, 7, and 9 clotting factors which are associated with vitamin K, and we have many other clotting factors. So these clotting factor deficiency occurs, and patient will have to suffer from bleeding, severe bleeding occurs. So hepatitis is mainly associated with bleeding. So this is very important disorder, and patient will have some other very important clinical presentations like cutaneous clinical presentations. So the skin becomes rough due to deficiency of vitamins. Vitamin A storage decreases, okay, and due to hyperpigmentation the skin becomes hyperpigmented, and melanin storage increases in the skin. So these are some cutaneous clinical presentations. And abdominal clinical presentations like abdominal distension and ascites storage or accumulation of the fluid in the abdomen is another clinical presentation. And abdomen pain is very important clinical presentation that can be seen with hepatitis. Okay, so these are some abdominal clinical presentations. And jaundice is very important. So accumulation of jaundice or increased concentration of bilirubin causes jaundice. So jaundice is very important clinical presentation. Portal hypertension is very important, and as you know, ascites, accumulation of fluid in the abdomen. And sexual characteristics. So patient will have to suffer from reduced gonadotropism or reduced hypogonadism occurs in the patients, and patient will have to suffer from gynecomastia. So sexual hormones concentration also reduces in the hepatic disease or hepatitis. So these are some clinical presentations, and in clinical presentations we have lab data. This all everyone, I think you all know the lab abnormalities, especially here in the liver function test. In liver function test, SGOT, SGPT like AST and ALT liver enzymes are elevated to 5 to 10 times higher in the normal, and prothrombin time increases, and INR abnormalities can be seen in the lab. Serum albumin globulins are not present in the normal stages. So all these lab values are abnormal clinical presentations. And liver biopsy will be shown. So liver biopsy can be seen, that by that we can diagnose whether the hepatitis is caused either by presence of viral infection, bacterial infection, or by any other alcoholic disease or anything. Okay, so even imaging like ultrasound scan also can be seen with clinical presentation. And here I forgot to tell you the main cause. So among the causes, alcohol is another very important cause, alcohol and drugs. So actually in the chronic usage of alcohol, patient will have to suffer from production of acetaldehyde in the chronic alcoholic patients, and this acetaldehyde produces NADH, and increased amount of NADH causes oxidative stress, and this oxidative stress damages the hepatocytes. So liver cells will be damaged, and that causes hepatitis. So alcohol and drugs, many drugs starting from paracetamol. So I think you all know that high concentration or toxic amount of all the drugs, major 99% of drugs will cause hepatitis or hepatic failure. In the high concentration of drug usage will cause hepatitis. So these are some of the causes and clinical presentations of hepatitis and liver disease. Now let me tell you in detail about the viral hepatitis. I'll explain about the viral hepatitis now. So in the viral hepatitis we have hepatitis A virus, we have hepatitis B virus, hepatitis C virus, hepatitis D virus, and hepatitis E virus. Okay, now let us try to discuss in detail about hepatitis A virus. Remember guys, hepatitis A virus is caused by, actually hepatitis A or hepatitis A virus, actually the name of the virus is enterovirus 72. Enterovirus 72 is the major virus that causes hepatitis A, and it is also called picornavirus. It is also called picornavirus, and the incubation period of hepatitis A virus is 15 to 45 days. This is very important. You have to remember all these things, because if they ask write about the viral hepatitis, you have to explain all these different viral hepatitis. Okay, so this is incubation period of the hepatitis A. Now let us see the mode of transmission. Mode of transmission of hepatitis A. The mode of transmission of hepatitis A is fecal-oral route and sexual. So sexually hepatitis A will be transmitted, and through fecal-oral route to the contaminated water, so contaminated food materials or water, anything will cause hepatitis A virus. So this is very important. So sexual and fecal-oral is another. So treatment of hepatitis A virus, we have hepatitis A vaccine. So hepatitis A vaccine can be given for the prevention, and usually for hepatitis supportive care is given, and sometimes in the cirrhosis or in the liver failure, liver transplantation can be done. So this is about hepatitis A. And hepatitis B, listen guys, hepatitis B virus is mainly hepadna virus. Hepadna virus is the name of hepatitis B virus, and the incubation period of hepatitis B virus is 30 to 180 days, and mode of transmission is usually sexual, perinatal is very important, perinatal and percutaneous. Percutaneous is the route that causes transmission of hepatitis B. And listen guys, hepatitis B is very important. Hepatitis B is very important because most commonly occurring viral hepatitis is hepatitis B, and it is caused by sexual route, perinatal route and percutaneous route. Okay, so this is very important point. And this hepatitis B is also called serum hepatitis. This is important. Serum hepatitis. It is called serum hepatitis. And the treatment for hepatitis B viruses, we have some antiviral drugs like tenofovir. Tenofovir is the drug that tenofovir and entecavir are the first line drugs, and along with these drugs we also have vaccine. Hepatitis B vaccine is available for the prevention, and tenofovir and entecavir are first line drugs. Actually these are first line drugs, and other antiviral drugs are also available for hepatitis B. And hepatitis C is also another. Hepatitis C is caused by Hepatitis virus. C means Hepatitis virus, and incubation period of Hepatitis virus is 15 to 160 days. Okay, and this hepatitis C virus is usually transmitted by percutaneous route. This is important. Percutaneous route, CC, cutaneous. Remember, hepatitis C virus is usually transmitted through percutaneous route only. This is important. It is not transmitted by sexual route or fecal-oral route. Okay, this is important. And the treatment for hepatic, we have vaccine for the same hepatitis C virus. And listen guys, in the treatment, pegylated interferon is the drug that can be given in hepatitis C virus, and along with pegylated interferon we also have ribavirin. So ribavirin, which is a very important antiviral drug, which is given for Ebola virus and for swine flu virus. It is also presently ribavirus is given for COVID-19. So this is a very important, ribavir is very important antiviral drug. And we have hepatitis D virus. Hepatitis D virus is caused by delta virus. Just try to remember all these things. And incubation period for delta virus is 30 to 180 days, and it is transmitted through sexual route, perinatal route and percutaneous route. Okay, hepatitis D virus is, and treatment is common. So supportive treatment is given if the liver is failed, liver transplantation is done, and for reduction of the viral load, usually ribavirin is drug of choice, and even for this we have vaccination. And finally we have hepatitis E virus. Hepatitis E is somewhat very interesting. Listen guys, it is caused by calcivirus. Calcivirus is the name of hepatitis E virus. 15 to 60 days is the incubation period for this. And fecal-oral, only contaminated food and water will affect this hepatitis E virus. It is not transmitted through sexual route, it is not transmitted through percutaneous route, or it is not transmitted to any other route. Only fecal-oral route is the major route of transmission for this. And listen guys, in 1955 actually there is a endemic of hepatitis E virus. Endemic occurred in New Delhi. Okay, so in 1955 major endemic occurred, and this killed many of the people in the Delhi area. So this is the important point about hepatitis E virus. And even ribavirin is another drug of choice. Ribavirin is usually given drug for hepatitis E virus. So this is about different hepatitis A, B, C, D and E. So I think you understood about different viral diseases that causes hepatitis. Now let us go in detail about the treatment of different causes. In previously I have told you different causes for hepatitis, and for different causes I'll try to explain in brief about the different management options for hepatitis. So now let us try to see the management for hepatitis. Listen guys, if the patient has viral hepatitis, antiviral drug should be given along with supportive care. And for specific cause there are specific management options, and if there is no specific cause, we have to treat the patient with symptomatic treatment. So in the symptomatic treatment, listen guys, patient will have clotting abnormalities. And in clotting abnormalities, listen, clotting abnormalities is possible due to deficiency of vitamin K, as previously discussed. So vitamin K therapy, vitamin K is given for 2 to 3 doses daily should be given. So vitamin K is the drug of choice in clotting abnormalities. So this is one treatment option. And if the patient has ascites, ascites is nothing but accumulated fluid in the abdominal cavity. It's called ascites, and this ascites is treated with diuretics. Especially in the diuretics we go with first line drugs with potassium sparing diuretics, spironolactone. So spironolactone, and along with spironolactone we can also give loop diuretics like furosemide. So for ascites, diuretic is drug of choice. In that spironolactone can be given, and along with spironolactone, furosemide loop diuretic is also a drug of choice that can be given. Okay, and this is another treatment option for ascites if the patient has ascites. And along with diuretics, listen guys, there are some important surgical procedures that are performed to ascites, and there is a surgical procedure called paracentesis. Paracentesis is one of the surgical procedure where the abdominal cavity is punctured and fluid is removed from the abdominal cavity. So this is called paracentesis. And we have another surgical procedure called transjugular intrahepatic porto systemic shunt or shunting. See, transjugular intrahepatic porto systemic shunting is another another procedure for removal of fluid in from the abdomen. So it is also called TIPS, tips. Just remember it as tips. So okay, this is another surgical procedure that is performed to remove the excess amount of fluid from the abdomen. So this is given for ascites. And for specific viral infections, as earlier I told you about the antiviral drugs, and for bacteria and antibiotics are drug of choice. Antibiotics are given, and among antibiotics metronidazole is drug of choice. Okay, and now there is a very important clinical presentation called pruritus. Pruritus is very important. Pruritus is nothing but it is a itching disorder is called pruritus. So for the pruritus we have some drug of choices. Listen guys, this is very very important. Pruritus is very common with hepatitis, and for pruritus we have antihistamines, and in antihistamines some mild sedating drugs like cetirizine. Cetirizine is drug of choice, so antihistamine can be given. And along with antihistamine sometimes ursodeoxycholic acid is another drug of choice for pruritus, and along with this ursodeoxycholic acid rifampicin is given. And rifampicin opioid antagonists like naloxone and naltrexone, or some of the drugs that can be given for pruritus. So this is very important. And sometimes in pruritis, cholestyramine is very important drug that is given. So all these drugs are given for pruritus. Pruritus means itching. When the patient undergoes severe itching in the, it is also called hepatic pruritus. So in hepatic pruritus, antihistamines sometimes. So actually in pruritus, patient will suffer from itching condition and pain in the abdomen. So antihistamines will be treated better for pruritus. Ursodeoxycholic acid, rifampicin, opioid antagonist, and sometimes cholestyramine is also drug of choice for pruritus. And next, let us manage with, there is a condition called hepatic encephalopathy. Hepatic encephalopathy is very important clinical presentation. So hepatic encephalopathy is associated with, actually in the hepatitis, the main function of hepatic cells is production of uric acid from ammonia. So ammonia is converted into urea. Ammonia is converted to urea through urea cycle. But in failure of hepatic cells or in the dysfunctioned hepatic cells, ammonia concentration increases, and this ammonia concentration tries to accumulate in the brain. That causes hepatic encephalopathy, and hepatic encephalopathy is associated with many brain disorders. Okay, and in hepatic encephalopathy, listen guys, we have 4 different grades: grade 0, grade 1. Grade 0 is nothing but normal. Grade 1 hepatic encephalopathy is associated with mood disorder, or sometimes patient will have anxiety, depression, okay, mood disorder. And grade 2 hepatic encephalopathy is associated with drowsiness in grade 2. And in grade 3 patient will have confusion. And in grade 4, this is final stage of hepatic encephalopathy, in grade 4 patient will go into coma. So grade 4 is very dangerous one. So hepatic encephalopathy is associated with dysfunction in the brain or dysfunction of the neurons. So in that we have 4 different grades, and the grades have these clinical features. And in hepatic encephalopathy, the drug of choice is commonly given is lactulose. Lactulose is common drug given in hepatic encephalopathy, and along with lactulose, metronidazole also can be given, metronidazole, and sometimes neomycin is given. Rifampicin is also given for hepatic encephalopathy. So these are some of the treatment options for hepatic encephalopathy, and along with these drugs, supportive treatment is commonly given. Okay, so the next one is, I think you understood about hepatic encephalopathy. And next, esophageal varices. Esophageal varices is another clinical presentation. Actually, esophageal varices here, the blood vessels which are associated in the pharynx and in the GI tract, so they'll have dysfunction, and patient will suffer from bleeding in the esophagus. So this is usually this is associated with hepatitis. So esophageal varices is common condition which is associated with hepatitis. Now let us see the treatment for Wilson's disease. So I think you understood about Wilson's disease. Previously I was telling that Wilson's disease is usually characterized by accumulation of copper. So copper accumulation occurs, and that causes hepatitis. And in Wilson's disease, the drug of choice, or usually in copper poisoning, penicillamine is drug of choice. So penicillamine is given for the treatment of Wilson's disease. And in, as you know, in autoimmune disorders, autoimmune disorder is major disorder with hepatitis. And in autoimmune disorders, most of the autoimmune disorders, corticosteroids are given, and along with corticosteroids, azathioprine is another drug of choice that is given for autoimmune disorders. So these are different treatment options for hepatitis. And listen, while writing in the examination, for specific disorders you have to write these drugs, and without specific conditions you have to treat the patient symptomatically. So if the patient has bleeding disorder, give coagulants, and if the patient has reduced proteins, give excess amount of proteins. And if patient has toxic conditions like Wilson's disease and in iron accumulation conditions, detoxify that particular compound. Okay, so symptomatic treatment is very important in hepatitis, and for specific disorders these are commonly prescribed drugs. And don't forget that in viral hepatitis, where antiviral drugs are given, and vaccination is very important. And among explaining the viral hepatitis, don't forget to write the transmission as well as the incubation period of different viral hepatitis. So this is a just overview of hepatitis and hepatic failure and liver failure disease. This video will help you only in the exam point of view, and thank you for watching.